Imagine a bustling city, its lifeline dependent on a complex network of roads and highways. These routes transport vital supplies, ensuring the city thrives. Now, picture a sudden blockage on a major highway, cutting off essential resources from reaching their destination. This is what happens during a stroke. A stroke occurs when the blood supply to part of the brain is interrupted or reduced. Brain cells are deprived of oxygen and nutrients, leading to damage. Just like in our city analogy, the affected area of the brain can no longer function properly. Strokes are a serious medical emergency. They can cause lasting brain damage, long-term disability, or even death. Time is of the essence when it comes to stroke. The faster blood flow is restored to the brain, the better the chances of survival and recovery. Strokes can be categorized into different types, each with its own characteristics and implications. First, we have ischemic stroke. This is the most common type, accounting for about 87% of all strokes. An ischemic stroke occurs when a blood clot blocks an artery supplying blood to the brain. Think of it as a traffic jam on our city highway, bringing everything to a standstill. Next is hemorrhagic stroke. This type occurs when a blood vessel in the brain ruptures or leaks. It's like a burst pipe in our city, flooding the surrounding area. Hemorrhagic strokes are less common than ischemic strokes, but often more severe. Lastly, we have Transient Ischemic Attack, or TIA. Often called a mini-stroke, a TIA is a temporary blockage of blood flow to the brain. Symptoms are similar to a stroke, but resolve quickly, usually within minutes or hours. Think of it as a brief detour in our city, causing a temporary disruption. However, a TIA is a warning sign of a potential future stroke and should never be ignored. To effectively combat stroke, we need to understand the factors that contribute to its occurrence. Several key culprits can disrupt the delicate balance within our blood vessels. Consistently elevated blood pressure puts excessive strain on artery walls, increasing the risk of both ischemic and hemorrhagic strokes. High levels of cholesterol, particularly LDL, bad cholesterol, contribute to plaque buildup in arteries, a condition known as atherosclerosis, increasing the likelihood of blockages. This heart rhythm disorder causes the heart's upper chambers to beat irregularly, increasing the risk of blood clots forming and traveling to the brain. Elevated blood sugar levels can damage blood vessels, making them more susceptible to narrowing and blockage. This harmful habit damages blood vessels, raises blood pressure, and increases the risk of blood clots, all contributing factors to stroke. While some risk factors for stroke are beyond our control, others can be modified through lifestyle changes and medical management. Understanding this distinction empowers us to take charge of our health. Stroke risk increases with age, especially after 55. Men have a slightly higher risk of stroke than women. However, women are more likely to die from stroke. African Americans, Hispanic Americans, and American Indians have a higher risk of stroke than Caucasians. A family history of stroke increases your risk. Having a prior stroke or TIA significantly elevates the risk of another stroke. Regular monitoring and medication can effectively manage blood pressure levels. Lifestyle changes and medication can lower cholesterol levels. Proper management with medication, diet, and exercise can reduce stroke risk. Quitting smoking is one of the most significant steps you can take to prevent stroke. Maintaining a healthy weight through diet and exercise is crucial. Regular physical activity lowers stroke risk. A diet high in saturated fats, trans fats, and cholesterol increases stroke risk. Fortifying your defenses, lifestyle changes for stroke prevention. Just as a well-defended city is better equipped to withstand a siege, adopting healthy lifestyle practices strengthens our body's defenses against stroke. 1. Maintain a healthy diet. Embrace a diet rich in fruits, vegetables, whole grains, and lean protein sources. Limit saturated and trans fats, cholesterol, and sodium. 2. Engage in regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, spread throughout the week. 3. Maintain a healthy weight. If you are overweight or obese, even a small amount of weight loss can make a significant difference in your stroke risk. 4. Don't smoke. If you smoke, quitting is the single most important thing you can do to reduce your risk of stroke. 5. Limit alcohol consumption. If you choose to drink alcohol, do so in moderation. 6. Manage stress. Find healthy ways to cope with stress, such as exercise, relaxation techniques, or spending time with loved ones. 7. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Be fast. Recognizing the warning signs of stroke. Time is brain when it comes to stroke, making rapid recognition of symptoms crucial. The B FAST acronym provides an easy-to-remember guide. B. Balance, sudden loss of balance or coordination. E. Eyes, sudden vision changes such as blurred vision, double vision, or loss of vision in one or both eyes. F. Face, facial drooping, especially on one side. A. Arms, weakness or numbness in one or both arms. S. Speech, slurred speech or difficulty speaking or understanding speech. T. Time. If you experience any of these symptoms, call 911 immediately. Code Red, immediate actions for suspected stroke. Suspecting a stroke necessitates swift and decisive action. 1. Call 911 immediately. Don't delay. Every minute counts. 2. Note the time. When did the symptoms first appear? This information is crucial for medical professionals. 3. Stay with the person. Provide reassurance and support until medical help arrives. 4. Do not give anything to eat or drink. This could worsen the situation. 5. If the person becomes unconscious, check for breathing and pulse. If necessary, perform CPR. Winning the battle: treatment and rehabilitation for stroke. Stroke treatment depends on the type of stroke, severity, and the individual's overall health. Emergency treatment: ischemic stroke clot-busting medications known as TPA can dissolve the clot and restore blood flow. Mechanical thrombectomy, a minimally invasive procedure, can remove the clot using a catheter. Hemorrhagic stroke surgery may be necessary to stop bleeding or relieve pressure on the brain. Rehabilitation, physical therapy to regain strength, coordination and mobility. Occupational therapy to relearn daily living skills such as dressing, bathing and cooking. Speech therapy to improve speech and language skills. Cognitive rehabilitation to address thinking, memory and problem-solving difficulties. Life after the siege: recovery, support and long-term prevention. Recovering from a stroke is an ongoing journey. The brain possesses remarkable plasticity, but regaining lost function takes time, effort and support. Support systems, family and friends. A strong support system is invaluable during recovery. Support groups, connecting with others who have experienced stroke, can provide encouragement and practical advice. Healthcare professionals, doctors, nurses, therapists and other healthcare professionals play vital roles in guiding recovery. Long-term prevention: follow your doctor's recommendations. Take medications as prescribed and attend follow-up appointments. Control risk factors. Continue to manage controllable risk factors through lifestyle changes and medication. Seek emotional and mental health support. Adjusting to life after a stroke can be challenging. Don't hesitate to seek professional help if needed. Specific prevention tips for younger adults. Focus on establishing healthy habits early on, such as maintaining a healthy weight, exercising regularly, and avoiding smoking. For older adults, be mindful of age-related risk factors and manage existing health conditions carefully. For women, be aware of unique risk factors such as pregnancy, preeclampsia, and hormone therapy. Securing a healthier future. Your action plan against stroke. World Stroke Day is a call to action. By understanding stroke, recognizing its warning signs, and taking proactive steps toward prevention, we can significantly reduce its impact on individuals, families, and communities. Here's your action plan. 1. Know your numbers. Get regular checkups to monitor your blood pressure, cholesterol, and blood sugar levels. 2. Embrace a healthy lifestyle. Make healthy choices a part of your daily routine. 3. Be an advocate for your health. Ask your doctor about your stroke risk and discuss any concerns you may have. 4. Spread awareness. Share information about stroke prevention with your family, friends, and community. Together, let's build a future where stroke is no longer a threat to our well-being. By taking action today, we can protect ourselves and those we love from the devastating consequences of this preventable condition.